Hello and welcome to Healthwatch. I'm your host, Carolyn Wilson from Ledge Light Health District. The goal of this program is to bring you information on a wide range of interesting and important health topics and to introduce you to the people doing great work across the community. Today, I'm joined by Kris Magnussen, Emergency Preparedness and MRC Coordinator from Ledge Light Health District. And today, we will be discussing emergency preparedness. Kris, welcome to the show.
Thank you.
So you've been on the show several times. Welcome back. Thank you so much for being our guest today. And in the past, we've talked about things like vaccinations, and I believe during COVID, we had a couple of great talks with you about that. Today, we're going to shift gears a little bit and talk a little bit about emergency preparedness. So September happens to be Emergency Preparedness Month. So let's jump right in and talk about what you'd really love to convey to our folks watching today.
Oh, well, thanks for having me, especially since it is Emergency Preparedness Month. This year's theme is Preparedness Starts at Home. And really what it's all about is that each and every one of us has a responsibility to be prepared for an emergency and not expect that the cavalry is going to come in and rescue us, which happens too often. We've seen with storms where people don't evacuate and then they're in trouble. And for whatever reason, maybe first responders can't go out in the weather because the winds have picked up, or they're just overwhelmed with calls. So really what I want to talk about today is what we can do to be prepared for any and everything that could come our way.
So important. And I just got off a cruise ship not long ago. I was on vacation, and we've been fairly spared so far this hurricane season. And I think a lot of people think about storms and hurricanes the most, especially this time of year. But folks watching may feel like they're not ready for an emergency, no matter what it is, whether it be a storm or something else. What would you say are the best tips, and how can people be prepared for emergency preparedness?
Well, first of all, there's a lot of great information out there. So it's not like you have to think about what to do. Ready.gov and American Red Cross have a lot of great information on how to be prepared. So I would start with that. Then the other thing is you have to think about what are the risks? What should I be prepared for? If you live in California, you worry about earthquakes. That's not something that we have to worry about. So it's really important to think about what's happened in your neighborhood in the past or your town. What are the type storms you've seen over the years? We all do hazard vulnerability analysis. Towns do it. The Council of Governments does it. Hospitals, long-term care. They all do hazard vulnerability. And pretty much what we know for our area is that flooding is really the number one hazard that we all have to contend with. And then the others are winter storms, especially loss of power, and then infectious disease outbreaks, pandemics. We've had 2 pandemics in our time, and we know there'll be another one. So knowing those, and then knowing maybe what some of the issues have been in your neighborhood or at your home, then you can sort of start planning. So keep in mind that just because flooding is the number one thing that we see here, don't think that you're going to be spared because you don't live near water. I have to tell you that a number of years ago, we were flooded and it looked like we had a moat around our house. And we found out later, the emergency management director went out and spent a lot of time trying to figure out what had happened, is that a development had gone in. We never saw the development, but it went in and it changed the topography. And then a beaver had built a dam nowhere near us, but it affected us. So don't think that just because you don't live near a river or stream or whatever that, I don't have to worry about flooding. It can happen. So knowing that these are the things that happen in your area. Now, also, if you live within 10 miles of millstone, the chances of anything ever happening there are slim, slim, slim. But do you know what to do? Are you prepared? And so knowing your risks, then you can sort of start planning. And don't forget the things that could happen in your own home. A fire, devastating. So you really need to sit down with your family and talk about these things. So if you live within 10 miles of Millstone, have you talked to your family about if the kids get evacuated by the school and you're at work and your spouse is somewhere else, where are you going to meet up? How are you going to communicate with each other? So you need to sit down, and this is where Ready.gov and American Red Cross really have great information about conversations that you can have as a family. The other thing too is I really like how with preparedness, a lot of times they'll talk about home, hand, and head. And so what they're talking about is in your home, you should have certain things there at all times. We discovered with a storm that there was an apartment complex. Not one person had a flashlight, not one person. So, there's great lists out there of what you should have in your home. Flashlights, food, canned foods, bottled water. If you know there's a storm coming, go out and buy bottled water. We figure a gallon per person. Non-perishable foods. Think about what you eat and canned foods and just rotate them. I like tuna fish, so I always make sure I have tuna here. I have packets of mayonnaise if need be. I just want to say when it comes to food, that people get caught up with dates, expiration dates, use by. Just so you know, the federal regulations require only baby formula have an expiration date. Connecticut requires milk products. So your canned foods and your bottled water that all have expiration dates or use by, that purely is to do with quality. And those are all safe to have unless there's damage to the cans or something like that. So keep that in mind. Try to rotate the stock if you can. Where are your documents? Do you know where your insurance papers are? Just make sure that you know where things are located, that in the event that you had to evacuate, you could do that quickly. Do you have a portable radio? Keep your phone charged at all times. And then in their hands, if you had to evacuate, what are the things you're going to take with you? People always forget their glasses, their hearing aids. They forget important papers. I can't tell you in the shelters how many times people don't know who their oxygen company is. They don't have the telephone number for their daughter because they left their cell phone and nobody's dialing the phone anymore. And then in their heads, think about what will we do if there's a fire in the house, and talk about it. Maybe talk to somebody in the fire department what to do. You want to get down low. If you have a door that's shut, put your hand against it. If it's hot, you don't open it. So you want to talk about these things. If there's a storm, what are we going to do? What are we going to take if we have to evacuate? And so I kind of like how that I'm seeing more and more of that thinking. And I'll tell you, if you just think about it, when it happens, you'll have the memory, and it should just quickly, you can put everything into place. That's kind of a long answer.
Well, that's really important to consider because I think people want to be prepared. There's no worse feeling than not feeling prepared when there's something scary or anxiety producing going on. So I think that's a great way to think of it. Home, hand, and head. I think that's great. So when it comes to emergency preparedness, I think not everybody thinks about public health, maybe emergency management, but certainly there is a connection. And some people may not know the role that health departments play in emergency preparedness, that we really are leaders in the process. What is Ledge Light's role in emergency preparedness?
Well, I sort of view that we have two roles. And the first one is building resilience in our communities. And that's what you do, Carolyn. That's what all of our staff does, different ways. The healthier a community, the greater the recovery. If you don't have a healthy community, as we saw with Katrina, it's devastating. So through Ledge Light, we do a lot of building of resilience through everything from food pantries, blood pressure clinics, vaccinations, food inspections, well inspection, land use. I mean, the list goes on and on. Each and every person that works at Ledge Light, their role is to ensure that people stay healthy, but also, help some of them get healthy. And then second, we are charged with having emergency preparedness plans. I don't think people are aware how much preparedness planning goes on in their communities. Every town has an emergency management director who has plans. Schools have plans. Long-term care and hospitals have plans. Public health has plans. And so that's, I sort of view probably what's even more important that we do is the building of resilience. Because if you have an unhealthy population, they're not going to handle the stress and the physical demands that can occur with disasters. And we've seen that. At the same time Katrina was happening, there was devastating floods in the Dakotas. You rarely heard anything about it because it was a very healthy community with great resilience, and they bounced back from it much quicker than we saw with Katrina. So I'm charged with writing plans. And as a nurse, I really enjoy that because there's a lot of networking with other folks doing preparedness plans. There's a lot of thinking about scenarios and what should we do, what's realistic, a lot of doing exercises, not physical exercises, but preparedness exercises to help us to be, ready in the event. So a good example is since 2012, Ledge Light has been doing drive-through flu clinics. We were the first in the state to do that. Very popular. By doing that, our staff knows what to do, our volunteers know what to do. It goes quickly, and in a really bad emergency, let's say bioterrorism, where we need to get antibiotics into people quickly, what a great way to do that. People stay in their cars, come through quickly and get it. And actually we've exercised that. So that's really Ledge Light's role, is helping people to get healthy, stay healthy, and have plans in place.
Okay, great. So we're going to take a quick break. We hope that you will join us right back here for more Health Watch.
For decades, I've taught you everything I know. How to safely build a fire, and how to control the flames. But I can only teach wildfire prevention. Only you can prevent wildfires.
Welcome back to Health Watch. Today I'm joined by Kris Magnussen from Ledge Light Health District, and today we're talking about emergency preparedness. So Kris, right before we took a break, we started introducing the concept of planning and Ledge Light's role in that planning. It's so important regionally, statewide, and of course nationally. Let's talk a little bit about those technical aspects and responsibilities. How do we determine what plans to write or what exercises we need to be doing?
So there are a few ways. As I said before, people need to know the risks in their area, the hazards, so that they can plan. We do the same. Like I said, we know that flooding is an issue, infectious diseases, winter storms, loss of electricity. So some plans may center on that, but also too, our funding for emergency preparedness comes from the Centers for Disease Control, CDC. And so they mandate what plans need to be done so that we're all prepared. So we do what we call local plans, which means I do Ledge Lights plans. We do a regional plan, even though there's no regional authority. We work as a region. We have 5 regions in Connecticut. We're Region 4, which is the eastern side of Connecticut, goes up to the Mass border and over to Rhode Island. And I write plans for the region. And then we have state plans that are written by the Connecticut Department of Public Health. And so we're all basically mandated by the CDC that we have to have plans in place for dispensing of medical countermeasures, be vaccines or oral medications, that we need to have plans for anthrax, release of anthrax, which is a very credible threat, that we need to have flu pandemic plans, which, especially after COVID, we've had to, change a little bit. We had to have Ebola plans when Ebola was on the site. Smallpox plans were big few years ago. So they're the ones that tell us what plans are mandated. We call those deliverables. So we have to show that we've done those, and the CDC then, we get paid to do these things. So, and then, there's some things that we just do plan-wise to make sure that we all stay healthy at Ledge Light. So we call those responder safety and health plans. So we have a lot of plans. Sometimes you find that they work and sometimes they don't, and that's why we do exercises. We do what we call a full-scale exercise where we have all our partners, and we've had, fire department, police, EMS, behavioral health, have all done exercises with us. And sometimes we find that that doesn't work that well. And so that's the beauty of it, that we can improve the plans every time. And we love to have input from the public. And when we've done our drive-throughs, we really have had great input to help improve the plans.
Great. Now, one of the take-home messages of today is planning is important, and we do need to be ready for anything. And we never want to create fear, of course, but being prepared is important. You did mention that public health is responsible for mass dispensing of medical countermeasures. Can you explain what that involves?
So in the event, like the pandemic, we were one of the first in public health was the first really to get the vaccine, whether it was the H1N1 or the COVID vaccine. And then we're charged with dispensing it to the public. And medical countermeasures come from the Strategic National Stockpile. So it comes from the government and it's delivered to the states. And it may just be an isolated incident that's occurring. With the pandemic, we all had our vaccine shipped individually to our local health districts, and then we were responsible for giving it to the public. Also, too, they provide antibiotics, but they also provide lots of equipment. So during the pandemic, they provided ventilators to the hospitals if they didn't have enough. But we get the medical countermeasures that are pretty much medications. So as I said before, anthrax, aerosolized anthrax, is a credible threat. It can be made from soil. And so we've done a lot of planning and training and exercises on that, simply because if something like that were to happen, it's difficult to diagnose at first because it comes across as flu-like. But unfortunately, if the person isn't treated, death could ensue. And so we would be required to pass out antibiotics to the area that was involved, which could be a large area. We have no idea. So we've planned for our whole jurisdiction. We have our sites, we have our plans, we've done exercises for them. And that's where the drive-through works so well. Because if you can imagine that something like this happened and you were told you got to go get antibiotics, to stand in a long line would be difficult. People would start getting angry. So that's sort of the beauty of doing the drive-through. And we did it using antibiotics, fake ones, and realized that the plan worked really, really well. So those are the things that we've planned for, we've done. Years ago, like I said, it was smallpox. Now that's not the big concern. The concern more is bioterrorism.
Right. So, as you mentioned, public health is all about partnerships. With emergency preparedness, we often see public health partnering with regular healthcare to work together to keep people safe. Now, Ledge Light Health District has a medical reserve corps. Can you explain a little bit about that and what they do?
Sure. So Medical Reserve Corps came about after 9/11. President Bush felt that there should be a credentialed unit of medical and non-medical to respond to public health emergencies. And so it is a federal program. It's all over the country and in the territories. We've been in existence since 2007. And there is no way that we could have vaccinated all the folks that we did during H1N1. I was the only nurse. There is no way that I could have. We did sometimes upwards of 1,000 people a night. It was our volunteers, and the same with COVID and flu clinics. It's our volunteers. They're medical and non-medical. They have background checks. They're credentialed. We do trainings. They have just been indispensable. I mean, there is no way that we could respond to anything without their assistance. They've really been a godsend. We have 6 MRC volunteers since the pandemic that every week have volunteered at a food pantry. So sometimes it has nothing to do with vaccinating or passing out medications. Sometimes it's non-medical. And surprisingly enough, these, all except one, they're all medical: physicians, dentists, and nurses. They're committed to their communities. They want to be of value to their communities. And so if anybody is interested in joining the MRC, they can go to Connecticut Responds. They can Google Connecticut Responds or call us at Ledge Light. We do a background check, like I said. You have to go online and fill out an application. And then if you're available, great. If you're not, we understand.
Awesome. Well, it sounds like it's a great opportunity for folks. I know that there's so many things that they can do once they get involved, but I know that they value it as much as we do. So it's a great program. Now, I'm all about take-home messages, of course, and as we wrap up today, when it comes to emergency preparedness, we talked about head, hand, home, and a couple of other take-home messages. What do you want our viewers today to really walk away with from this conversation?
You know, I just want people to take responsibility for their own self and family, and to be prepared. Look around your neighborhood, look around where you live. Are there things that need to be taken care of so they don't become a disaster for you? If you have a house with dead trees around it, Do you really want to wait for a storm to knock it down? Will your insurance cover it? So that is the first thing, is just look around, see what you can do to prevent things from happening. And then spend some time going to those sites, like I said before, ready.gov, American Red Cross, and just give some thought about how you and your family can get prepared. I think what's always interesting, I don't know how others feel, but when I watch the news about some of these places with war where people are having to evacuate, I often think, gosh, if I had to evacuate and maybe never come back home, what am I going to take? I know that may be far-fetched, but it does make you stop and think. If they're young, they're going to say they're going to take their cell phone and their computer. But when we actually have done this exercise with the MRC, what if the infrastructure's been destroyed and there is no electricity? A lot of good that's going to do you. So give it some thought, do some planning. It shouldn't cost a lot to be prepared. You can do it in increments. Make sure you have batteries. If there's a storm coming, go out and get certain supplies and be ready. You'll use them at some point. They're not going to go to waste. And if they say there's mandatory evacuation, please do it. Don't wait till something happens or somebody responding gets hurt. So take responsibility for your own safety. Get that flashlight. We were stuck at that apartment building. Not one person had a flashlight.
Right. So thank you so much, Kris. These tips are so helpful, and I know that Emergency Preparedness Month will have all sorts of information on Ledge Light's social media, of course. And thank you to our viewers for tuning in. We hope you enjoyed this program, and we hope we'll see you back right here on Health Watch.